Let's talk a little bit about the enrollment period for Medicare. When is that, and what do people need to consider, and what do they need to do to go through that enrollment plan again, or what should they be looking at?
In terms of, Ken, if you're asking when someone is new to Medicare, in many ways that happens automatically. Someone is usually notified 3 months before their 65th birthday that they'll be eligible for Medicare. They make their decision if they are at that point retired and need the Medicare program, that they make their decision, accept Medicare, and then, beginning the first day of their birthday month, they're eligible for Medicare. There are different options that go along with that. The enrollment periods that are right upon us now is like the annual election period, as I mentioned earlier. That's from November 15th through December 31st, and that's when people make these initial decisions, Medicare beneficiaries, about their drug coverage. Beginning January 1st through March 31st is the Medicare Advantage open enrollment period. So there are really two enrollment periods that run side by side, and during that period, Medicare beneficiaries can leave original Medicare and choose one of these health plans to meet their coverage needs. Oftentimes, the Medicare Advantage health plans include prescription drug coverage. It's almost like, I liken it to what coverage was like when we were actively employed. We usually had one card that was both our prescription access as well as our medical access. And the Medicare Advantage options are our newest options in the Medicare program. And because of that, there's a learning curve, not only for the beneficiary, but also for the provider who makes the decision whether or not they're going to accept or not accept these particular plans. We often, caution people before they sign up. They should always make sure that their current physicians and the hospitals where they would access services accept the plan that is available to them, because these plans are not statewide. They are really filed with the Centers for Medicare and Medicaid Services on a county-by-county basis. And someone could go to our SHIP website if they're not aware of what programs are available in their county, and actually look up their county and see what Medicare Advantage plans are there. So we have this ongoing enrollment period, or they can call our office, of course, too, to ask what's available in their county.
Good. And we've got the phone number for the SHIP office, and we also have the email or the internet address for the SHIP office. So a lot of valuable information, I'm sure, on that website. What other information could a person find if they go to the SHIP website?
Well, I think they can find information about Medicare supplements. We actually have an active database of all the Medicare supplement plans licensed in North Carolina, where someone simply picks, selects in a link box their age, whether they're male or female, what Medicare supplement standardized plan they're interested in, and whether they smoke or not. And then actually the department provides for them the current premium that's on file for every licensed program available in North Carolina. Like I was saying earlier, they can find all sorts of consumer-friendly information from how to enroll in Medicare, to how to file SMP complaints. It's really a large website with lots and lots of information. And someone could even find out how to volunteer in either the SHIP program or the SMP program. And we're always actively looking for dedicated people. We are blessed in the SHIP program to have 700 volunteers throughout the state who sit in their communities and actually counsel people on these choices. We couldn't, as a state entity, meet the needs of the entire state, and so we always are welcoming anyone who is interested to give us a call, and we'll be happy to talk to them about the volunteer opportunities we offer.